dry mouth or xerostomia is a major cause of halitosis or bad breath. Patients complaining of dry mouth or xerostomia sometimes have difficulty with speaking, consuming, tasting meals, drinking and bad breath or halitosis. Often, a dry mouth could be mainly present during the night, particularly in mouth breathers. The dryness could cause chapped or damaged lip area or result in a prolonged cough. They might complain of swollen or sore areas in their oral cavity, or a white tongue, an indicator of a fungal contamination such as yeast candidiasis. A burning tongue or perhaps respiratory tract, periodontitis, ulcers, sore areas, and swollen soft tissue are usually all outcomes of oral dryness. Without an adequate amount of saliva to rinse food contaminants on teeth, reduce the effects of acids in the oral cavity, and deal with the bacteria population, a patient regularly develops several cavities, particularly around the periodontal line, and halitosis. Despite the fact that certain conditions of dry mouth are naturally manifesting because we create significantly less saliva when we grow older, a majority of cases of xerostomia come from well-known factors, medications, typically prescribed for hypertension or depressive disorders, antihistamines, stress and anxiety, pain, allergic reactions, weight problems, pimples, epilepsy and mouthwashes with alcohol inside them. When your oral cavity is drier, you will have a reduced amount of saliva, among some other soluble elements. Saliva has oxygen, which maintains your oral cavity healthy and fresh. These types of bacteria are anaerobic, which basically signifies that they are going to flourish and make much more sulfur in the occurrence of hardly any oxygen. Consequently, when you have less saliva, you will have less oxygen, therefore establishing an anaerobic environment, ideal for the bacteria to generate more of these types of odorous and also bad nasty substances. Basically, the bacteria are now in a position to make increased levels of sulfur gases, which often create the bad breath or halitosis. Saliva is an extremely essential element of oral health. Saliva delivers three essential abilities: delivers enzymes to assist with the digestion of meals, gives you a solution to balance the pH, offers increased levels of oxygen in an effort to maintain oral tissues in good health. It is additionally correct that certain tongue formations are likewise more favorable to dry mouth compared to some others. It is connected to the theory by some people that bad breath could be an inherited characteristic. Honestly, patient cannot inherit the bacteria of bad breath or halitosis, however patient could inherit a particular structure of tongue, just like he would inherit a parent's eye and hair color, height, and even ear appearance. Certain patients could have a disorder called hairy tongue, which represents the fibers that make up of the tongue becoming significantly longer compared to the normal. When the tongue gets extremely dry, or in case of the tongue gets to be aggravated by extra tough scraping or even brushing, the external surface becomes extremely vulnerable. One common problem among seniors is burning tongue disorder. It is typical among both sexes, however moderately increased among females. That information has caused certain researchers to think that there exists a hormonal ingredient in burning tongue syndrome. A lot of individuals who are diabetic can observe a burning of the tongue when they become thirsty. It is crucial, once affected person has these kinds of signs and symptoms, to avoid oral rinses that could burn or perhaps create your oral cavity dry. The resulting discomfort is indescribably unpleasant according to Remediland. Apart from leading to the irritating signs and symptoms mentioned previously, dry mouth or xerostomia will increase a person's risk of gingivitis, tooth erosion, and oral cavity infections. The common suggestions for burning tongue syndrome and dry mouth or xerostomia is the following: avoid making use of oral solutions which create your mouth dry or perhaps have sodium lauryl sulfate. Quit consuming citrus juices. Stay away from coffee. You should never smoke cigarettes. See your doctor regarding risk of diabetic issues or thyroid difficulties. Affected individual who attempts the following in their everyday oral sanitation could significantly increase their oral health and reduce the occurrence of bad breath. Regular oral treatment for people with burning tongue syndrome, dry mouth or xerostomia. Cover tongue 2 times every day with toothpaste and let lay on tongue for 90 seconds. Rinse out with 1 to 2 cupfuls of oral rinse for 90 seconds. Consume 8 cups of drinking water every day. Take vitamin C every day as suggested on instructions. Chewing gum will help encourage salivary movement. However, it is vital that you memorize not to use chewing gum or perhaps candies which have sugar inside them, or the individual is going to be placed at greater risk for getting cavities. Artificial saliva replacements and oral lubricants which contain glycerin can provide benefit at the time of consuming and speaking. They won't treat xerostomia, but will give you some comfort. Save your tooth enamel by brushing with a fluoride toothpaste. Inhaling and exhaling via your nose, not your oral cavity, whenever possible. Making use of a room vaporizer to increase humidity to the bedroom.